Hello everyone, welcome to my YouTube channel Pharma Researcher. So this is the video number 5 for Telangana Pharmacist Grade-II exam preparation. The exam which is going to be held on the 30th of November 2024. So this is a new series on our YouTube channel Pharma Researcher in which we are discussing the MCQ questions for 10 different units which are mentioned in the syllabus. All the 10 units will be covered in this particular series and the unit wise MCQ questions, or we can say the simply topic wise MCQ questions, will be available for you with detailed explanation and additional information. So in this particular series, two units have already been covered, unit 1 and unit 2. If you want, you haven't watched those videos, so you can simply go to the description box. There you will find all the links for those particular videos, or else you can go to the Farmer Researcher YouTube channel, and you can simply go to the playlist section. There you will find a playlist Telangana Pharmacist Grade-II exam preparation. So in that playlist you will be getting all these relevant videos regarding this particular series. Now, if you want the PDF of the questions that are discussed in each of the videos, so you can simply go to the description box. There I have provided the link for PDF. You can simply click on the link and the PDF will open and you can simply download the PDF. So in today's video, I'm going to start the third unit of the syllabus, which is regarding basically the health education and community pharmacy, in which there are different topics: nutrition and health, demography and family planning, first aid, fundamental principles of microbiology, and communicable disease. Let's first see the this complete syllabus, like what different subtopics are there. So this is the unit number 3 and this is a part number 1 for this particular unit. This exam is going to be held on the 30th of November 2024. So in today's video we are going to discuss the half of the subtopics that are mentioned in this particular unit number 3. The first topic is concept of health, concept of disease, natural history of disease, disease agents, and concept of prevention of disease. Next topic is nutrition and health, in which there are different classification of foods, requirements, disease induced due to deficiency of proteins, vitamins and minerals, treatment and prevention. Then there is demography and family planning. Demography is cycle, fertility, family planning, and different methods. Then first aid. In this first aid topic, there is emergency treatment for shock, snake bite, wounds, heart disease, fractures, resuscitation methods, elements of minor surgery, and dressings. Other two topics that are fundamental principles of microbiology and a different communicable disease. So these last two topics will be covered in the next video. Today we are going to discuss these for first topic. Talking about this particular unit, so this unit is very important because the questions are very simple from this unit, very direct questions, and you can say like this particular unit is very easy and easy to score marks. So let's start with the first particular topic, that is the concept of health, concept of disease, natural history of diseases, disease agents, and concept of prevention of disease. So here you can simply find the definitions and several dimensions of health and several other topics. So let's start with the first question. So the question is, dash is a state of complete physical, mental and social well-being and not merely an absence of disease or infirmity. So basically this is the definition of health, and this definition is given by the WHO, that is World Health Organization. So they define the health as a state of complete physical, mental and social well-being. Means a person should be physically fit, mentally fit and socially fit. So this particular definition is given by WHO. Next question is, which of the following is or are dimensions of health? So here there are different dimensions of health. So it includes physical health, mental health, social health. So here all of the above will be the correct answer. So these are the dimensions of health. So with the name itself you will be able to get an idea like what kind of health will be determined in this particular dimension. Like physical, it will be your physical nature of the body, Then the mental health is related to your mental power. Social health is with the society, and also there are several other dimensions of health. For example, spiritual dimension or spiritual health. Then there is emotional health, and there is vocational health. So these are the different dimensions of health. These six, you can say, these are the dimensions of health, and by name itself you will be able to know like what kind of things will be discussed here. So this is quite easy. So here question answer is option number D, all of the above. Next question is, what are the signs of physical health in an individual? So uh, if the physical health of an person is good, then what are the different signs indicating this particular condition? So the person should have clear skin, bright eyes, and good appetite. So these are the few of the signs of physical health in an individual. Apart from this, a person will be having a good complexion. Also, he should sound sleep. There is a regular activity of bowel and bladder. The person should have smooth and easy coordinated movements, like the movements in the body. He must have a lustrous hairs. Then his or her body weight, pulse rate, blood pressure, etc. These all are in normal limits. The person should be physically fit, means he should not be too thin or not too fat. Then he should have a good proper breath, and also good appetite, bright skin, and clear skin. So these are the different signs of physical health. Then moving to next question. So the question is, which of the following is not a mental disorder? So there are different types of mental disorder. So here the question is, which of these is not a mental disorder? So psychosis, diabetes, depression, schizophrenia. So here you can simply identify diabetes is basically not a mental disorder. It is not related to mental health. So here option B is correct. It is basically related to blood sugar level. Means high blood sugar level is known as diabetes. Then next question is, which of the following is individual determinant of health? So basically the determinants of health are either individual, or there can be the other determinants which are environmental. Okay, first one is, there are two types of determinants of health. First is individual, and the second one is environmental. Second one is environmental. So in individual, here the question is, which of the following is individual determinant of health? So in individual determinant of health, it includes lifestyle, and genetic, which is hereditary. So here if you can see the option number A, it is the lifestyle is a individual determinant of health, while the other political will, socio-economic condition, health and family welfare services, and several other factors, these includes the environmental these include the environmental determinants of health. Then moving to next question. So the question is, mortality rate means. So the mortality rate simply means the death rate. So here option B will be the correct answer. The next question is, dash is defined as number of deaths per thousand population per year in a given community. So this is the definition of crude death rate basically. So crude death rate is per thousand population per year. What is the number of deaths? Number of deaths in a given community, whatever community is given. So in that particular community, how many persons are dying per thousand population? So that is a crude death rate. So these are simply the mortality indicators. You can say crude death rate is a mortality indicator. Then expectation of life, it is also an mortality indicator, and also infant mortality rate, child mortality rate. These all are the mortality indicators. So we have the definition of crude death rate. Now we can move to expectation of life. So what is expectation of life? So expectation of life is simply the average number of years. These are the average number of years that a person will be lived by a person if current age specific mortality rates are applied. Okay, if there are several mortality rates for the particular time, so for a particular time if specific mortality rates are applied, then what is the average number of years a person can live? For example, in uh, a country is A, and in this country the normally majority of person live for 70 years. This is the average time period of a person to live in this earth. So these are the expectation of life. Then talking about the infant mortality rate. So infant mortality rate is simply the rate of death. These are the rate of deaths which are under the 1 year of age, which are under 1 year of age in a given year to the total number of live births in the same year. For example, if in 2024 there are 50 deaths of infants are which are less than 1 years of age, and there is total 1000 births, there are 1000 births of there are 1000 births for the same year, that is 2024. So the ratio of these is known as the infant mortality rate simply. Then there is child mortality rate. So child mortality rate is the similar thing, like it is defined as the number of deaths. It is same, the number of deaths for age group 1 to 4 years. The children which are at age group 1 to 4 years in a given year, for example in the year 2024, per 1000 children in that age group. Like for every 1000 childrens of 1 to 4 years, how many childrens of the same age group are dying in a particular year? So that is the child mortality rate. Then there is another mortality indicator, that is maternal mortality rate. That is maternal mortality rate. So for maternal mortality rate, it is simply the total number of deaths, but it is specifically for those women's which are of reproductive age, women's with a reproductive age. So this is a maternal mortality rate. So these are the different mortality indicators. The definition can be asked, so these are important. Next question is, disease is defined as. So how can you define the disease? So basically disease is any condition in which our body is not functioning properly, or there is a improper functioning or dysfunctioning of our body's different organs or a specific organ. So these can be defined as a disease. So here if we can see the options, first option is physiological or psychological dysfunction, like a person has a physical dysfunction, or psychological, that is mental also, so that can be considered as a disease. Or any deviation from normal state of complete physical, mental or social well-being. So basically if you can see, like we have different parameters for this, for dimensions of health. So in those dimensions of health, for example physical, mental, social, spiritual, emotional, vocational, so if any of this dimension of health is disturbed, that will be considered as a disease. So here this is a scenario, like any deviation from normal state of complete physical, mental or social well-being is also the definition of disease. Then the condition of the body or organ of the body in which its functions are disturbed. For example if I can say for kidney, if The main function of kidney is the filtration of urine. So basically, if the kidney is not working, it is improperly filtering the urine. So in that case, that is also a disease. So these all are the definitions of disease. So here we can say all of the above is correct. Next question is, which phase in the natural history of disease causative agent exists in the environment? So, in the natural history of disease, there are different phases. Mainly, there are two phases. One is pre-pathogenesis phase. The second phase is pathogenesis phase. So, what happens? So, in pre-pathogenesis phase, in this phase, the causative agent exists in the environment. What? The causative agent exists in the environment, and in this phase, the man is exposed to a risk of disease. Okay, so if the causative organism is present in the environment, then the man who is traveling in that environment, uh, so that person will be exposed to the disease. So this is a condition for pre-pathogenesis phase. Second phase is pathogenesis phase. So in pathogenesis phase, so this phase basically starts with the entry of agent into the human host. So what happens in pre-pathogenesis phase? The causative agent is in the environment. Now a person is infected by this causative agent. Now this causative agent is in the body of the person. Then this phase will start the pathogenesis phase. So here the question is, which phase in the natural history of disease causative agent exists in the environment phase? So this is the pre-pathogenesis phase. So here option A is correct. So here you need to remember both these phases because this topic is specifically mentioned like the natural history of disease. Next question is, which of the following are the physical disease agents? So the disease agents can be of different types. Like they can be physical, they can be chemical, they can be biological, nutrient agents, mechanical agents, social agents. So these different types of agents can be there. So if we can talk about the physical disease agents, so physical means heat, cold, humidity, radiation, sound. So these all comes under the physical disease agents. Then if I'll talk about the bacteria, viruses, fungi, protozoa, so these all are the biological agents. Then the protein, fats and carbohydrates, these are the nutrient agents. These are the nutrient agents. Then the urea, bilirubin, pollen, fumes. So these all comes under the chemical agents. Then there are several other categories, for example, mechanical agents. For example, mechanical agents. So in mechanical agents, there can be examples like vibration, chronic friction, chronic friction. So these type of mechanical agents can lead to trauma. Then there are several social agents. Social agents can be poverty, it can be smoking, it can be alcohol, it can be unhealthy lifestyle. So these are the different social agents. So this category you need to know. Then moving to the next question. So the question is, the concept of prevention of disease includes. So concept of prevention of disease, it includes basically three main phases or three main sections. First is primary prevention, second is secondary prevention, and third is tertiary prevention. So these all are the concept of prevention of diseases. So here option D, all of the above is correct. Now what happens in these three phases? So basically, if I'll talk about the primary prevention, so in primary prevention, these are the actions that are taken prior to the onset of disease. Prior to the onset of disease means disease is not basically spreaded, or it is not basically the onset has not started. So before that, if actions is taken in order to prevent the disease, which will remove the possibility that disease will ever occur. So that is the concept of prevention of disease. We can say like the vaccinations. So if we have a vaccination for a particular disease that can happen in the future, so we have already taken the vaccine, so now there are very less chances that this particular disease will happen to us in the future. So these are the primary preventions. Then the secondary prevention. So secondary preventions are those actions which are taken to half the process of progress of disease. Like once the a person is having a disease and the disease has progressed around half of its cycle has been done, or you can say at an very early stage. So at that early stage, if any prevention measures has been taken, then that will be considered as a secondary prevention. Then the third is tertiary prevention. So tertiary preventions, these are all measures that are available, all measures that are available now to reduce or limit impairments and disabilities. Like if a disease has been attacked to our body, and now it is at a certain level, it becomes chronic. So in order to reduce any impairment or disabilities that can be caused to our body through that particular disease, so whatever measures are available to reduce that, those measures are comes under tertiary prevention. So it basically includes the disability prevention or rehabilitation of the patients. So these are basically the three main concepts of prevention of disease. So with this particular question, only 11 questions I have included in this, because mostly these very simpler topics are there in this particular topic. Now coming to the next topic, that is the nutrition and health, which includes classification of food, requirements, disease induced due to deficiency of proteins, vitamins, minerals, and treatment and prevention. So basically in this I haven't included the classification of food. So I have included the requirements and diseases induced, because mostly if the question will be asked from this topic only. Mostly the question will be asked from the diseases part only, but it can be asked from the requirement perspective also. But there is 100% chances that the question will be asked from the diseases, because this is the main important thing. So the diseases can be asked from proteins, from vitamins, or from minerals. So all these are important. Now we can start with the first question of this topic. So the question is, marasmus is associated with. So marasmus is a condition which is associated with protein and carbohydrate deficiency. So if in our body protein and carbohydrate both are in deficient quantity, our body is supplemented with deficient amount of protein and carbohydrate, then the condition will be uh, called as marasmus. So these are basically the terms for malnutrition. Then moving to next question, a dietary deficiency in the quantity of protein results in. So if only protein quantity is deficient in our diet, then that condition is known as kwashiorkor. So here option D is correct. And all the symptoms, whatever symptoms you will see in this kwashiorkor or marasmus, the symptoms are almost similar kind of things. Then moving to the next question. So the question is, which of the following are the symptoms for kwashiorkor disease? So the different symptoms for kwashiorkor disease, which is the dietary deficiency of protein, are retarded growth, edema, or hypoalbuminemia. Then also GIT disturbances can be seen, psychic changes, hypoglycemia, enlargement of liver. These all are the symptoms associated with the kwashiorkor disease, and these all are the symptoms that can be seen with the marasmus disease. So here option D, all of the above, will be the correct answer. Next question is, which of the following is not a macro mineral? So minerals can be macro minerals or micro minerals, which can be also called as micronutrients and macronutrients. So basically, what are macro minerals or macronutrients? So these are basically those nutrients which are required in the large quantity. Macro means in large quantity. Other term is micronutrients, which means which are required in the very less quantity, which are required in very less quantity. Now you need to know like what are the different examples. So in macro minerals, it can be calcium, it can be phosphorus, it can be sodium, it can be potassium, it can be magnesium, it can be iron, or it can be zinc. These are the different macro minerals which are required in our body in large quantity. Then if we can see in this particular question what I mentioned, like calcium is there, potassium is there, sorry, this is phosphorus is there, sodium is there, and cobalt is not there, so it is not a macro mineral. So basically cobalt is a micro mineral, it is a micro mineral. So here option D is correct. Now we can talk about the micro minerals. What are the examples of micro minerals? So in micro minerals it can be copper, cobalt, copper, iodine, selenium, manganese. So these are the different examples of micronutrients. So now we can move to the next question. So the question is, which of the following mineral is function in the transport of oxygen? So in the transport of oxygen, the mineral that is involved is iron. So here option C is the correct answer. Then moving to the next question. So the question is, goiter is caused due to the deficiency of. So you you need to learn total 5 important minerals that are very important, in which the disease cause are very important and the doses are very important. So goiter is a condition that is caused due to the deficiency of iodine. So here option A will be the correct answer. Now with iodine there can be several other conditions, other deficiency diseases apart from goiter. Goiter is very important because question asked from goiter only. Then there can be cretinism condition can be asked. Then there can be hypothyroidism. These are the different conditions associated with deficiency of iodine. Then if I'll talk about iron, so for iron anemia is the most important condition. Then hemochromatosis, so these are different conditions are associated with deficiency of iron. Then if I'll talk about the sodium, the deficiency conditions are hyponatremia, hyponatremia, and very important, Addison's disease, and very important, Addison's disease. Then with in calcium, the conditions are rickets and osteomalacia. These two conditions are also associated with deficiency of vitamin D. Apart from this, hypocalcemia, osteoporosis, osteoporosis, and tetany. So these are the different deficiency conditions associated with calcium. Apart from these, phosphorus is also important. So with phosphorus, there can be different conditions associated, which are hypophosphatemia, hypophosphatemia. There can be rickets also, and there can be osteomalacia. So these are the difference with phosphorus. So these all different conditions you need to remember. Most important is goiter, then Addison's disease, then anemia, then these rickets and osteoporosis, these conditions. So these are very important. Now moving to the next question. So the question is, Addison's disease is caused due to the deficiency of. So this we have discussed, like this is the sodium. So here option C is the correct answer. Then next question is, anemia is caused due to the deficiency of. So the deficiency disease with of anemia is with iron. So here option B is correct. Next question is, what is the adult daily requirement of iodine? So now this is regarding the daily requirement of iodine. So this is 50 gram per day. 50 gram per day is the daily requirement of iodine. So here option A is the correct answer. Apart from this, if I'll talk about calcium, so the daily requirement of calcium is 400 to 500 mg per day. This is in adults, and 500 to 600 mg per day in infants and children. Then if I'll talk about phosphorus, so for phosphorus, the adult daily requirement is 0.8 gram per day and 0.2 to 0.3 grams per day in infants or children. Then for sodium, in case of sodium, the daily requirement is 10 to 15 gram per day in adults. Then there is iron. For iron, the daily requirement is 2 to 6 grams per day for adults. So these are the simple daily requirements for different these minerals. So only this question is included, so you can remember the other daily requirements from this particular explanation. Next, moving to next question. So the question is, which of the following is water soluble vitamin? So this vitamin topic will also be covered in the biochemistry part. So here I have included all the relevant questions, most of the relevant questions that are very important in this particular section also. So the water soluble vitamin is vitamin B and vitamin C. So here if you can see, the vitamin C is here. So vitamin C is the water soluble vitamin. The other vitamin A, vitamin D, vitamin E and vitamin K, these four are the fat soluble vitamins. These are the fat soluble vitamins. Next, moving to the next question. So the question is, vitamin B2 is also known as. So the other name for vitamin B2 is riboflavin. So here option B is the correct answer. If I'll talk about thiamine, so thiamine is the vitamin B1, niacin is vitamin B3, and pyridoxine is vitamin V6. Then there are several other names of the vitamins. For example, vitamin B5, which is pantothenic acid, Then there is vitamin B9, which is folic acid, Then there is vitamin B12, which is cyanocobalamin, and there is vitamin C, which is ascorbic acid. So these are the different names of several vitamins. Now moving to the next question. So the question is, deficiency of vitamin A causes, very important question. So the deficiency diseases of vitamin A are night blindness, xerophthalmia, Bitot spots, also conjunctival xerosis. So these are the different conditions, deficiency conditions associated with deficiency of vitamin A. So here option D, all of the above is correct. Next question is, deficiency of vitamin dash causes pellagra. So pellagra is caused by the deficiency of vitamin B3. So here option B is correct. And B3 is niacin. Then next question is, inadequate intake of folic acid can lead to. So basically the deficiency of folic acid can lead to megaloblastic anemia. So here option D is correct. Next question is, the vitamin involved in the biosynthesis of collagen is. So the vitamin which is involved in the biosynthesis of collagen is ascorbic acid, which is vitamin C. So option C is correct. Next question is, phyloquinone is another name for. So phyloquinone is basically the another name for vitamin K. So here option D is correct. Basically, there are three forms of vitamin K: K1, K2, and K3. So we can discuss the name of these three different forms of vitamin K. So basically, the vitamin K1 is phyloquinone, K2 is menaquinone, K2 is menaquinone, and K3 is menadione. K3 is menadione. So these are the three forms of vitamin K. Sometimes the question can be asked from the name for a specific form of vitamin K. Next question is pyridoxine is the chemical name of. So pyridoxine is the chemical name for vitamin B6. So here option C is the correct answer. Next question is protein is made up of. So basically proteins are made up of amino acids. Different amino acids are joined with the peptide bond and form the proteins. Next question is cracks in lips is deficiency symptom of which vitamin? So cracks in lips are the deficiency symptoms of vitamin B2, that is riboflavin. So option B is correct. Next question is which vitamin contains steroidal structure? So the steroidal structure is contained in vitamin D. So here option C is correct. Next question is deficiency of vitamin D causes. So deficiency diseases of vitamin D are or rickets and osteomalacia. So rickets is in children and osteomalacia is in adults. Next question is due to riboflavin deficiency dash is caused. So riboflavin deficiency, that is vitamin B2, and due to its deficiency chelosis condition is caused. So here option C is correct. Next question is a chemical name of vitamin K3 is. So this I have explained you like what is the chemical name of vitamin K3. So vitamin K3 is menadione. So here option B is correct. And vitamin K2 is menaquinone. Vitamin K1 is phyloquinone. Then next question is vitamin K regulates the synthesis of blood clotting factors. So vitamin K regulates the synthesis of factor number 2, factor number 7, factor number 9, and factor number 10. This I have explained you in human anatomy part also. So here option D, all of these will be the correct answer. Next question is which vitamin has antioxidant properties? So the vitamin which is having antioxidant properties is vitamin E. So here option D is correct. Next question is anti-sterility vitamin is. So the anti-sterility vitamin is vitamin E, which is also known as tocopherol. Tocopherol. Then next question is Wernicke-Korsakoff syndrome is due to the deficiency of vitamin. So the Wernicke-Korsakoff syndrome, it is due to the deficiency of vitamin B1, that is thiamine. Next question is which vitamin serves as reducing agent? So the vitamin which serves as a reducing agent is ascorbic acid. So here option C is correct. Next question is what is the adult daily requirement of vitamin D? So the adult daily requirement of vitamin D is 25 micrograms. So here option B is correct. If I'll talk about vitamin A, so its daily requirement is around 750 micrograms in adults and 250 to 600 in children's. Then in children's, vitamin D requirement is around 5 micrograms. Then for vitamin C, daily requirement is 40 mg per day for both children and adults. Then for vitamin B1, it is 0.5 mg per 100 kilocalories per day. Then vitamin B2, it is 0.6 mg per 1000 kilocalories per day. Then there is niacin vitamin B3, which is having 6.6 mg per 1000 kilocalories per day. Then there is vitamin B12, which is also important. 1 microgram per day is the daily requirement for both adult and children. So these are the different daily requirements. Now we can simply discuss the different, we can simply revise the different deficiency diseases associated with different vitamins. First, I'll talk about vitamin A. So, with vitamin A, the deficiency condition is night blindness, conjunctival, conjunctival xerosis, Bitort's sport, then xerophthalmia. So these are the different deficiency conditions with vitamin A. Then vitamin D is rickets and osteomalacia. Then with vitamin C, the condition is scurvy. Then with vitamin B1, there is condition known as very or Wernicke-Korsakoff syndrome. Then with vitamin B2, there can be conditions known as corneal ulcers, cataracts, photophobia, and chelosis. Then with niacin, that is vitamin B3, the condition is pellagra. That's why it is also known as pellagra preventive factor. Then with vitamin B12, there is condition known as pernicious anemia. Pernicious anemia. So these are the different conditions. Then with the vitamin B9, that is folic acid, there is condition megaloblastic anemia. Megaloblastic anemia. So these are the very important deficiency conditions. So with this topic is also completed. Now we can have few of the nutrition related programs that are developed by the government of India. So here you can see the nutrition related programs developed by government of India. First one is vitamin A prophylaxis program. So this program basically helps for the control of blindness and involves administration of a single massive dose of oily preparation of vitamin A containing 2 lakh international units. Next program is prophylaxis against nutritional edema. So it basically involves the distribution of iron and folic acid tablets. Next program is control of iodine deficiency disorders. So for this program involves the replacement of edible salt with the by ionized salt. Then the next program is special nutrition programs. So these programs are started for the benefit of children below 6 years of age, pregnant and nursing mothers in urban slums, tribal areas, and backward rural areas. Then there is Valvadi Nutrition Program. So it is basically for children in the age group 3 to 6 years in rural areas. Then there are midday meal programs. So the objective of this program is basically to attract more and more children to schools and retain them. So it involves providing them balanced diet. So these are the different important programs. The question may be asked less chances, but may be asked from here also. Or for a basic understanding, you can remember these programs. Maybe aim can be asked or some other things. So a basic information is provided. Now we can move to the next topic, that is the demography and family planning. So this is quite simple and interesting topic. So demographic cycle, fertility, family planning methods. So these are the three main topics in this particular section. So coming to the first question. So the first question is, fourth stage, that is a low stationary stage of demographic cycle, is characterized by. So in total there are 5 stages. How many? There are 5 stages in the demographic cycle, and these 5 stages are divided as, like, the first stage is high stationary. First stage is high stationary stage. In this stage, the and birth rate and death rate, these are very high. Both are very high. So birth rate and death rate, these both are very high. So there is no increase in the population size. The person, if 1,000 children are born, then 1,000 old people are dying. So this is the rate. So then there will be no increase in the population. The population is stable. So this condition is of India. This is the condition of India till 1920. Till which year? Till 1920 year. This is the condition of India, that is a high stationary phase of demographic cycle. So in this particular demographic cycle, the chances are very high like the question will be asked. So these 5 stages are very simple, and you can easily remember these things. So here what you need to know is, first is the name of the stage, second is the birth rate and death rate, and the third is the example. So for first stage we have already discussed high stationary stage, both are high, birth rate and death rate is high, and the population size is not changing. And the example is India till 1920. So then next stage is second stage, which is early expanding stage, So in this particular stage, what happens? There are two conditions for birth rate and death rate. Now this birth rate will be stable means unchanged, and the death rate will decrease. So now what happens, like previously there are 1,000 people dying and 1,000 people are uh, having birth. So now this rate will be same, and the death rate will decrease. Now there will be 900 people are dying. So now there will be a trend is shown, like the population size will start increasing. So this is the second stage, and the examples of this stage is South Asia and African countries, South of Asia or Africa. So these are the examples of early expanding stage. Then the third stage is late expanding. So what is the condition in this late expanding stage? So in late expanding stage, the death rate will continue to fall. It will decrease only, and birth rate will also start decreasing, but population size will still increases. Population size still increases in the late expanding, because the death rate is higher as compared to birth rate. So both are decreasing, but the rate of decrease of death rate is more. So this is the condition. Now the examples of this are China and Singapore. These are the examples of these of late expanding stage. Then there is the fourth stage, which is the low stationary stage. So low stationary stage, the death rate is low as well as birth rate is low, and both are equally low in a constant population. So the population size will be unchanged. Or we can say population size is again stabilized. So this is the condition for fourth stage, and this fourth stage is also known as zero population growth stage. The example of this stage is UK, Denmark, Sweden, Belgium. So these are the examples of stage number 4. Then the fifth stage is declining stage. So now I have explained you the fourth stage. Meanwhile, I am explaining you the fifth stage. You can find out the answer from the given options. Then I will be giving the answer. The fifth stage is declining phase. So in declining phase, what happens? The population will decrease because the birth rate will be rapidly decreasing, or we can say birth rate will be lower as compared to death rate. Both are decreasing, like the birth rate will be decreasing and death rate is also decreasing, but the birth rate is decreasing at a higher speed as compared to death rate. So population will start decreasing, population size will also start decreasing, and the example of this is Germany and Hungary. and Hungary. These are the examples of declining stage. Now coming back to the question is fourth stage, that is a low stationary stage of demographic cycle, is characterized by. So what we have seen is in the low stationary stage, there will be decrease in the birth rate and there will be decrease in the death rate also, and these both are decreasing in the same level, in the, or we can say in the same rate, so that there is no change in the population size. The population is stabilized, and this stage was known as zero population growth stage. So here we can see like low birth rate and low death rate. This is the suitable condition for this particular phase of stage of demographic cycle. So here option C will be the correct answer. Now everything is clear for this demographic cycle. Only these five stages are important, examples are important. The characterization was important, like what is the characterization for birth rate and death rate, and the names are important. You can easily remember those. Then moving to the next question. So the question is, which stage of demographic cycle is known as late expanding stage? So the late expanding stage was the third stage. We can again recall the names. First one is high stationary stage. Second one is expanding, early expanding. Here we can say stationary, high stationary stage. Then the third is late expanding, and the fourth is low stationary stage, and the fifth one was declining. So last one was quite easy, like it is the declining phase. This you can remember, the first and fourth are the stationary phase. First is high stationary, the fourth is low stationary, and similar for second and third. Both are expanding stages. The second is the early expanding and the third is late expanding. Now the next question is, which countries comes under early expanding stage of demographic cycle? So the countries which are coming under the early expanding stage of demographic cycle include Africa. So here option A is correct. If I'll talk about the China, so China will come under late expanding stage, late expanding. If I'll talk about Sweden, it is the low stationary stage. And if I'll talk about the Germany, it is the declining stage. Next question is, dash means the actual wearing of children. So the definition for actual wearing of children, so it is fertility. Fertility is the actual wearing of children. So here option A is correct. Next question is, which of the following factors affect the fertility? So the different factors that affect the fertility include age of marriage, duration of married life, spacing of children's. So these all are the factors that affect the fertility. So here option D is correct. Apart from these factors, the education, economic status, the religions and caste, the nutrition, the family planning, the physical, social, biological, cultural factors. These all are the different factors that can affect the fertility, which means the actual bearing of children. So here option D, all of the above will be the correct answer. Next question is, what are the objectives of family planning? So the objective of family planning is to avoid the unwanted birth, is to bring about wanted births, and to regulate the intervals between pregnancies. Also to control the time at which birth occurs in relation to ages of parents. Also to determine the number of children's in the family. So these all are the different objectives of family planning. So here option D is the correct answer, that is all of the above. Then moving to the next question. So the next question is, IUD stands for. What is IUD? So IUD is the intrauterine devices. So these are basically the methods of contraceptions which comes under the temporary methods or spacing methods. So here option A will be the correct answer. Next, moving to the next question. The question is, male sterilization is also known as. So male sterilization is vasectomy. So here option B is correct. So in this particular method, the vast differences is cut. The vast differences is cut is cut. That is in the male reproductive system. So this particular, these are basically the tubes which carry the semen to the penis. So these are cutted, and the flow of semen will stop. So this is the main sterilization or contraception, permanent contraception method in males. Next is female sterilization is also known as. So female sterilization, it is also known as tubectomy. So in this, the fallopian tubes are cutted, which is in the females. So here option A will be the correct answer, and that is the permanent sterilization method. You can say permanent sterilization or permanent contraception method in females. Next question is, which of the following is permanent method of family planning or contraception? So diaphragms, oral pills, abstinence. So these are the temporary methods. These are the temporary methods or spacing methods. While laparoscopy along with the male sterilization and female sterilization method, that are vasectomy and tubectomy, these are the permanent methods. So here option D will be the correct answer. That is, laparoscopy is not a temporary method, it is a permanent method. Next question is, which of the following is third generation IUD? So the third generation IUD is progestasert. So here option D is correct. So IUD, I have already explained to you, like these are the intrauterine devices, and these are basically devices used for the sterilization or for the contraception. So in this, there are different generation of IUDs are used, like lips loop. These are the first generation IUDs. So in this lips loop, there is a S-shaped device which is having a nylon thread which is lined with the polyethylene plastic material. Polyethylene plastic material, and the nylon thread is connected to other end. So this other end is projects into the vagina. It is projected into the vagina, and if the thread will fall, means the falling of thread into vagina assures that the loop is in the place properly. So this is the basic process of lips loop, which is the first generation intrauterine device. Then talking about the copper T and Nova T, these both are the second generation uh, second generation IUDs. And in copper T, there is basically a copper element is used. So copper is having anti-fertility effect. It is having anti-fertility effects. So this is the main thing. Then talking about progestasert. So these are the T-shaped devices which are filled with progesterone. These are filled with progesterone, and they have the direct local effect. They have the direct local effect on uterine lining, as well as on the cervical mucus, and on the sperms as well. Then moving to the next question. So the question is, which of the following method of family planning is known as calendar method? So the method of family planning which is known as calendar method is rhythm method. So here option A will be the correct answer. Now we can discuss the different methods of family planning or different methods of contraception. So basically these are broadly categorized into two categories. One is temporary methods, or we can say spacing method. So this can be the question, like which of the methods are known as spacing methods. So these are the temporary methods. So in temporary methods, there are different categories of methods. For example, in first one is barrier methods. barrier methods. Now these barrier methods can be physical, like physical barrier methods, or these can be chemical barrier methods. In physical barrier methods, there are different condoms for males, there are diaphragms, vaginal sponges for females. So these are the different examples of physical methods. Then for chemical methods, there are several foam tubes, there can be several creams, suppositories, jellies and paste that can be used uh, for the contraception. Then the next is the IUDs. IUDs, these we have already discussed. Several are medicated IUDs and the non-medicated IUDs. Then there can be the third one, that is the hormonal methods. Hormonal methods. In hormonal methods, you can use the oral pills. You can use the slow released preparations, for example, vaginal rings or implants. Then the other type is post conception method. Post conception method. So these includes menstrual regulation. These includes menstrual regulation. These includes menstrual induction. Menstrual induction. These include abortion. So these are the different examples of post conception methods. There can be several natural methods. There can be several natural methods which includes abstinence. Abstinence. It includes coitus interruption. Coitus interruption. It includes safe period. Safe period. This safe period is known as the rhythm method or the calendar method. Then there can be a method known as cervical mucus method. So these are the different things. So these are the few top questions from this particular topic. Mostly in the previous question papers, I have seen questions from the demographic cycle, and the methods of family planning, in which mostly the questions are from the IUDs, and mostly the question is for male sterilization name and female sterilization name. So these important questions you can revise. Now we can move to the next question, next topic of today, that is the first aid. So in first aid, there are several topics like the emergency treatment in shock, snake bite wounds, heart diseases, fracture and resuscitation methods, and elements of minor surgery and dressings. So let's start with the first question. So the first question is, what is first aid? So what is first aid? So simply the first aid means, if you can simply see the term first. First means in Hindi it is pehli, and aid means the help. Aid means help. So the first help that is given to the victim of an accident or situation any other serious situation, so that will be considered as a first aid. So the first help given to the victim of a accident is the first aid. Next question is, what is a first aid for unconscious patients? So for unconscious patients, what is the first aid means, what is the first help given to the unconscious patient? So it is the CPR. So here option A is correct. What is CPR? CPR is cardio cardiopulmonary cardiopulmonary resuscitation. The next question is, full form of CPR is, so this is cardiopulmonary resuscitation. So here option C is correct. Next question is, what is the recommended compression to breath ratio for CPR in adults? So the recommended compression to breath ratio for CPR in adults is 30 compressions to 2 breaths. 30 compression then 2 breaths. So this is the general procedure in CPRs. Next question is, the CPR can be done by ABC formula. Here A stands for. So in CPR we use the ABC formula. So in ABC formula, A stands for airways, So here option B is correct. Then in ABC formula, B stands for breathing, B stands for breathing, and C stands for cardiac massage, cardiac massage, or chest chest massage. So these are the terms ABC in ABC. A stands for airway, B stands for breathing, C for cardiac chest, a cardiac massage or chest massage. Then coming to next question. So the question is, which of the following is artificial respiration method? So the artificial respiration method includes the Sylvester method, the chest pressure arm lift method, which is the Sylvester method only, then the Holzer-Nielsen method. These all are the artificial respiration methods. So here option D, all of the above is correct. So the Sylvester method, it is the chest press arm lift method. The Holzer-Nielsen method, so this Holzer-Nielsen method is also known as back pressure, is also known as back pressure arm lift method. So these another name you can remember. Next question is, in which of the following condition is the Holzer-Nielsen method utilized? The Holzer-Nielsen method is utilized for artificial respiration. So the first condition is asphyxia. So asphyxia is basically a condition in which there is deficient supply of oxygen. Oxygen is deficient to the body, which arises from abnormal breathing, which arises from abnormal breathing. So abnormal breathing, so for this particular condition we use the Holzer-Nielsen method to give the artificial respiration. Then if I'll talk about anorexia, so anorexia is basically a condition which is a eating disorder that is characterized by food restrictions, body mass disturbances, or fear of gaining weight. So these are the eating food disorders. Then talking about dysplasia. So dysplasia is basically a term that is used to describe the presence of abnormal cells which are within the tissue or organ. Basically, dysphagia is not a cancer, but it can sometimes develop into a cancer. Then talking about hyperemia. So hyperemia condition is basically occurs when the excess blood builds up in the vascular system. If in the vascular system, if the amount of blood will be high, the excess blood will build up, then that condition is known as hyperemia. Then moving to the next question. So the question is, which type of shock is due to spinal cord injury? The shock that is due to spinal cord injury is neurogenic shock. So here option C is the correct answer. Then there are different other types of shocks that can be due to several other conditions. If I'll talk about cardiac shock, so it is due to heart diseases. So with the name itself, it is pretty much clear. Then the hypovolemic shock. The hypovolemic shock is due to dehydration. This is very important. It is due to dehydration or due to loss of blood or due to loss of blood or plasma. Then there is a bacteremia shock. So it is basically due to various several infections, that is basically due to different microorganisms. Then there are hemo-obstructive shock, which is hemo-obstructive shock, and this is due to the blockage of main blood vessels. It is due to blockage of main blood vessels. The next is anaphylactic shock. Anaphylactic shock, which is due to injection to penicillin, which is due to injection of penicillin, basically due to the several other allergic reactions. So these are the few of the different types of shocks. Very important question can be asked from this part also. Then coming to next question. So the question is, dash are sharp cuts caused by sharp cuts caused by sharp weapons like knife or sword. Okay, So basically, these are the sharp cuts which are caused by sharp weapons like knife or sword. So there are basically 2 to 3 types of cuts, or we can say bounds. So these are the incise bounds, which are the sharp cuts due to knife or sword. There can be lacerated bounds. So the lacerated bounds are basically caused by the blunt objects such as stone or hammer. Then there are another type which is the punctured bounds, which is punctured bounds. So punctured bounds are simply those bounds which are caused by penetration of pointed or sharp weapons. For example, same for knife or screwdriver. So with these sharp pointed weapons, if these weapons are penetrated in our body, and they can also damage the internal organs also if they go deep in the body. So these type of bounds are known as punctured bounds. Then moving to next question. The question is, some people are very allergic to insect bites and stings. This condition is called. So people that are allergic to insect bites and stings, these are the conditions known as anaphylactic shock. So here option D is correct. Next question is, the accepted treatment for a sprained ankle is. So for sprained ankle, the accepted treatment is keep the shoe on, apply the ankle splint, and apply heat if possible. Okay, so this is the accepted treatment, or you can say the first aid treatment for sprained ankle. Next question is, what is the best definition of the hurry cases? Hurry cases are those which any condition that threatens the victim's life, any condition that threatens the victim's life in which the emergency actions are needed. So these are the hurry cases. For example, if a person met with an accident on the road, he is bleeding, so those conditions are known as hurry cases. We need emergency ambulances so that the person will reach in the hospital timely, and the first aid should be given at the time of accident only. Next question is, to treat a first degree burn you should. So to treat first degree burn, so the first aid treatment for this is apply cool running water until there is little or no remaining pain. Okay, we need to cool that burn until there will be no pain. This is the first treatment or first aid given to a first degree burn. So here option D is correct. Next question is, what is the appropriate treatment for a suspected broken collarbone or shoulder? So the appropriate treatment for suspected broken collarbone or shoulder is, we can simply apply a simple sling, bind the sling to the chest with a cravat. So here option A will be the correct answer. So you can also read the other options, like the PDF will be provided to you. So you can also read the other options, and then you can practice these questions as well. Then moving to the next question. So the question is, how do you recognize the signs of a heart attack? So there are different signs and symptoms of heart attack, like the chest pain or discomfort, shortness of breath, nausea. So these are the different signs of heart attack. So here option A is correct. Next question is, what is the correct method to control severe bleeding? In order to control severe bleeding, we have to apply pressure directly to the wound from where the bleeding is coming out with a clean cloth or with your hand. So this is the correct method to control the severe bleeding. So here option B is correct. Next question is, what is the first step in caring for a burn? So simply we can say the first aid for burn is, we can simply apply a cold compress or immerse the burn in a cool water. So here option A is correct. So this is the different form of the question that we have discussed previously. Next question is, what is the recommended treatment for a dislocated joint? So for dislocated joint, we can simply immobilize the joint and seek medical attention. So this is the recommended treatment, because if we apply any pressure on the joints, or if we try to sort the things on ourselves, then there can be several other major complications. Then the next question is, what should you do if someone is experiencing a heart stroke? So if someone is experiencing a heart stroke, then we can move them to a cool place, remove the excess clothing from him or her, apply cool wet towels or ice packs. So this is the general general treatment, or the basic first aid treatment, if someone is experiencing a heart stroke, that we can do. So here option B is correct. Next question is, how do you treat a minor burn that does not involve broken skin? So for minor burn which does not involve the broken skin, what we can do is we can rinse the burn with cold water and cover it with sterile dressing. So here option B will be the correct answer. Next question is, what is the recommended treatment for a snake bite? So for snake bite, the recommended treatment is immobilize the affected limb and seek medical attention immediately. So this is a basic recommended treatment. So here option C is correct. Next question is, how should you care for a minor cut or bound? So for minor cut or bound, we can simply rinse the bound with soap and water, apply an antiseptic ointment, cover it with a sterile dressing. So this is a basic primary care for minor cut or bound. So here option A will be the correct answer. Then next question is, which of the following are the elements of minor surgery and dressing? So the element of minor surgery and dressings include scissors, local anesthetics, rubber, hand gloves. So basically the elements of minor surgery and dressings are those elements or those parts or of components that are required for any minor operation. So these all are the basic requirements for a minor operation. So here option D, all of the above is correct. Also, I have provided you the list of the elements of minor surgery and dressings. So basically, if you can see the definition, like elements of minor surgery and dressings means necessary parts of the components required for minor operations. So these includes the sterile absorbent, cotton, adhesive tape, dressing bandages, scissors, forceps, sponge holding forceps, sutured surgical needle holder, rubber hand gloves, antiseptic creams like nitrophenazone cream, cetrimide cream, local anesthetics like xylocaine. So these are the different elements of minor surgery and dressings. So with this particular topic, we are done for today. Now we can meet tomorrow in the next video, in which we will be going to discuss the remaining two topics, that are the fundamental principles of microbiology and communicable diseases. So these are the important things. So yeah, that's all for this particular video. We can meet in the next video. Till then, thank you very much.